Welcome back to The New Norm. I'm Dr. Lou Graham, and this program is brought to you by Midway Dental and Catapult Education. So my guest today, and this will be a great show, there's no doubt this will be a great show, is a doctor who really has walked the walk for 25 plus years. She practiced in New England for the first 10, moved into opened her own Chicago Smile Spa, literally after practice in New England, then opened this practice, and that practice grew and grew over her 15 years. Before, I should say after she retired, I'm not even gonna go there. While she was practicing, I remember driving by her Lincoln Park practice because we both practiced in Chicago. I never saw her enough. And her practice was so progressive. The big smile posters outside, and she was doing things like 6-month smiles back then. She was teaching veneers with David Hornbrook and Pack Live and doing all those things, hands-on programs all over the country. And we're talking the early 2000s. So way when I consider veneers and cosmetic dentistry hitting the boom, and then really, or the initial boom, and she was so much a part of that. So after she, I guess, sold her practice, she then got an MBA and now is a managing partner with the company with Fortune Management. She is an incredible, lively person. I can only praise what she's done in her life and continues to. So when I asked her, write me a little sentence or two, she says, I like to partner with dentists to help them dream more, learn more, do more, and become more. And I think for Fortune Practice Management as a company, they couldn't be luckier to have someone literally as a client, as a consultant who can help her clients in such a way that she's walked the walk now on both ends. So welcome, Dr. Gerilyn Alfe, and it's really great to have you. So I'm gonna say, who better than to start off a discussion where we are today with this COVID era. And I just want to welcome you and say thanks for joining us today.
Thanks so much, Lou. I'm so excited to be here with you. And we used to joke that the only time Lou and I would see each other is when we were out of Chicago at a dental meeting somewhere else in the world, right? That was the only time we ever saw each other. We live
so
about
true.
5 miles from each other.
Right. Literally, I can't even, it's like when you're in the same town, it just never works. And so mutual admiration, or at least me for you, absolutely.
Right back at you.
And thank you. So let me go with the first question. So when we were talking about doing this interview, I put together 3 questions from your initial input of questions, and I want to go with the first question. Here we are, and I want to look at this from a business dental overview, because we are in business and we're dentists. So let's look at it in the overview. And let's start off with, what do you see as the top challenges for an office today versus the pre-COVID era? We are totally in the COVID era. It's not going anywhere. And with that, before you start, let me say, we've always had challenges in dentistry. I remember when your lead assistant quit. I don't know why I remember that or what happened there, but we've always faced challenges. I have, obviously, year after year. But what particularly do you see as the challenges in the COVID era today? Walk me through your thoughts.
Sure, Lou. When this all started, I know that I started speaking to a number of dentists, most of whom are younger than me. And some of them hadn't even been in practice as an owner as recently as 2008. So for people like you and me, Lou, who have lived through when the financial meltdown happened in 98, and then 2000, and the tech bubble burst, and then 9/11, and then the 2008 significant financial meltdown, I think those of us in our age group were a little bit more mentally prepared for what was happening, whereas the younger dentists, not so much. And what I'm finding as I talk to more and more dentists is that there are really 3 different areas that they're feeling the most challenge. The first is an actual physical challenge. With the additional PPE that everybody is required to wear, it is, a lot of them tell me it's very hot, it is really tiresome by the end of the day. And having such a challenge with communication with their team and their patients, because many of them are wearing the N95 mask and the surgical mask over that, and a face shield and a head covering and a gown. And so now think about how much of our communication is really by body language and by tone. And so it's really important for doctors and their teams to be very aware of the fact that their words may be garbled through all this additional PPE. And so being super conscientious about having a gentle and comforting and confident tone with their patients, and also using body language a little bit better, making sure they're keeping an open body language when they talk to their patients, especially about anything that might be a concern for the patients, is more important than ever.
So let's start on a couple of those subjects. As a managing partner for Fortune Practice Management, are you advising your clients first off to charge a PPE fee in their practices?
That's a great question, Lou. Yes, I am. I've been telling clients that for many years as dentists, we have kind of rolled in what our infection control costs are into our regular fees. As we all know now, those fees are quite onerous. There are a number of different levels of what the doctors need to commit to make their patients and their team and themselves feel comfortable and safe. And since insurance companies are across the board not reimbursing for that, it is something that is going to be an ongoing and possibly onerous cost. And I don't think there's anything wrong with a dental practice charging for that. I was out for dinner a few nights ago, and at the restaurant, there was a 4% PPE fee because they have to clean the tables more, they have to turn over differently, they have a lot of other additional costs that don't go into producing revenue. And a dental business is no different from any other business. And in fact, even though we have always been at the forefront of providing the most high-level infection control for our patients, it is now at a whole different level, and there's no reason why the teams should be forced to take that on.
Right. So nationally, what kind of fee are you seeing for that?
You mean fear from the dentist or fear from the patients?
No, sorry. The national kind of a fee.
Oh, fee. I'm sorry. I thought you said fear.
That's okay. I was just trying to pretend I was talking through a mask. Yeah. Okay.
And I couldn't see your facial expression. So it's varying greatly depending upon the area of the country. Around here, it seems like most offices are charging around 20 to 30 per patient. And some in California are charging as much as 50 because, California tends to have a ton more regulations than almost anywhere else. Right.
So let's then just talk about, since the other subject before we go to question 2. So when we're talking to patients, once again, do the visual communication techniques work? Like, I always take off my shield. I'm obviously wearing a mask at all times. Everybody does in my practice. Even my patients do when I'm not working on them, they're wearing a mask. So I'll take off my shield, but are you, again, getting back, really emphasizing how, intraoral cameras, whether, a digital scan, all these things, do you feel those are right now pivotal or not pivotal in communication with these patients?
Absolutely pivotal. That old saying that a picture is worth 1,000 words is more true than ever. And even if the patient can't 100% understand your words through your double mask, if you're showing them on your computer screen some huge blow up of a broken tooth that they didn't know was there, then they can immediately make that connection that, oh yeah, Dr. Graham's right, I do need a crown on that tooth. So yes, it makes communication much easier.
Okay, so let me dive into question 2. So question 2 really is dentists in business. Okay, I graduated in the early 80s. I don't think any instructor in my school had any concept of business. When I'm out there now, I'm seeing new grads, getting some business. For the most part, dentists themselves have just very little business background. I'm huge into analytics. More and more dentists are getting into it, but there's still much more to running a practice than just looking at numbers. How do you, and I want to say this, What are the right action steps right now as you see for dentists in running a business, with what, for example, you offer and what they can do? What would be action steps 1, 2, and 3 that a dentist could take away from this as far as the business of dentistry, if I could ask you?
Sure. Well, the first one is making sure that they're invested in their team. We know that no dentist can run a successful practice alone. And those dentists that have previously invested a lot of time and money into getting their team as cross-trained as possible, as comfortable with communication, and being able to do sourcing and accountability with your team, where you basically have a middle management within your practice, where there's one individual who is each responsible for the 3 departments within the dental practice, which would be operative and clinical, hygiene, and then administrative, and then the 3 areas of accelerators, which is your marketing, new patients, and then hygiene reactivation and treatment reactivation. And so if each sourcing person is in charge of those departments, it doesn't mean that they're responsible to do every single thing related to that. They are accountable for the results, and then they work with their particular team within the practice to ensure that all of these systems are constantly being taken care of. And now, especially, I know that a lot of dentists are feeling, gee, I'm so busy because I was so backed up from all the months that we were closed. I can't even begin to worry about reactivating hygiene patients. And I say, it's like marketing. Don't shut your marketing off because you're busy. You need to make sure that those systems are in place on a regular basis so that you can continue to feed your pipeline. And you don't know coming down the road where there are a number of opportunities out there, which is the other thing that we're stressing to our clients and dentists across the country. I know that it's easy to focus on the risks involved with this situation. But if you're thinking about, gee, I really thought that I wanted to build my practice up in the next 5 years. Well, you may have some amazing opportunities right now. You might be able to merge with another colleague who has a similar mindset, similar ethics, and wants to run the same kind of practice as you. And within a very short period of time, you may be looking at doubling your patient base. You may be looking at acquiring practices from dentists that are in like your age group and my age group, Lou. Perhaps there are guys that wanted to practice for 5 or 10 years and owned their business and they were doing fine, and then COVID hit and they decided one of 2 things: either I still want to practice, but I don't want to run the business as much, and I want to step back a little, but I want to keep my fingers wet. So that's a great person to partner with to acquire that practice and basically buy them out over time. Or there are other dentists who just say, you know what, I'm done. And so there are a lot of opportunities out there for the dentists that are really taking advantage of looking ahead and not letting themselves get mired in the misery, as I say.
So I hear you on this. And I'm going to tell you, COVID affects all of us. And I will tell you, reactivation, for example, with hygiene, when we've lost a huge amount of hygienists in this country, there's been it happened in my practice, it's happened in so many of my friends' practices. That's been a problem, openly. I think dealing with all the PPE, all the new protocols, that's overwhelming to me and my colleagues. So let me just ask you this. As a consultant now, how do you, believe me, I think if I've been through so many wonderful consultants in my career, I swear by them. How does a dentist really start this process of engaging with what I call a key partner? How does that work, Jared? How does that work?
Well, the dentist, first and foremost, really should be sitting down and thinking about where do they want their life and their practice to be in 1 year, 3 years, 5 years, 10 years. And I know that that's different for a lot of us because, like you, Lou, I was lucky really early in my career. I had some amazing mentors and I got hooked up with a fantastic coach very early in my career. And I know there is no way that I would have done the things that I did if I didn't have her for support. And the support team, besides just your coach or your consultant, the other thing I always stress is make sure you've got a great support team of your other professionals, like your accountant, your attorney, your HR specialist, your financial planner, your banker, your wealth manager, because all of those together should be working really as a mastermind group to help the dentist be able to get their practice so it's a self-sustaining business that's really run by a well-run team that takes ownership in the practice. And then the dentist can go in and do what only the dentist can do, which is do great dentistry. And so once the dentist, a lot of times when people ask me, what's my ideal client? I usually say someone who's been out for about 5 to 10 years. Because do you agree, Lou, that at that point, we kind of had our clinical skills in hand. We kind of had already figured out which direction within general dentistry we wanted to go.
Yeah.
And for those of us that had a grander scheme in mind, that was when we realized, whoa, I really don't know anything about being a great leader, being the CEO of my business, and how to communicate effectively with other people. Because those are the 3 things we're not taught in dental school. And you know that you have to have those skills if you want to be a successful leader of your dental practice, right?
I not only agree, I think the word coach more than consultant. And I think, and I'm going to say this is not bullshit. I really think dentists who get so focused like I do on my clinical care, business would often come second, and I would miss huge opportunities. And that's when I would bring in my coaches and consultants to go, should I invest here? Should I do this? There's an opportunity down the block with another business. I mean, I think coaches and consultants really are almost an essential tool. Otherwise, and I'm not negative DSOs, but ultimately that's what a DSO is.
Yep.
They really just take all that over for a dentist and say, hi, you go work clinically. But the difference is if you want to be independent, that's where a coach or a clinical consultant could just allow you to be independent and go to the next level. I don't know. Isn't that kind of like that?
Absolutely. And I always say to dentists when they ask me, well, why would I need a coach? And I always say, well, Tom Brady has a coach. Tiger Woods has a coach. I mean, both of them have multiple coaches, right? Michael Jordan had a coach. Wayne Gretzky had a coach. Anybody that hits the level of beyond excellent within their profession has a coach, because those people realize their job is just to get their skill as ideal as possible. And there are others that know more and also have a very different outlook about what are the factors going into why you're in the place that you're in right now. And even if that's a good place, it doesn't mean that you can't be in a great place. And it is nearly impossible for one dentist working full-time, running their own practice, to be able to sit back and be able to really objectively look at, how's my team working? How's my marketing working? What are we doing for new patients? What are all my systems in place? Do I have the best software available? What other technology do I need to get into the office? Because as dentists, we want a cookbook, right, Lou? We work best by that, because success within our clinical practice means that we have certain steps that we have to follow in a certain order. And I don't know if we're pre-programmed, and that's why we love dentistry, or we become even more automated because of that. And because there is no cookbook on how to run and build a successful business, because every practice is different. And a really good coach starts with the doctor's vision for his or her practice. What do you want this to look like, feel like, smell like when a new patient walks in? What kind of dentistry do you want to do? What do you want your team to look like? How much do you want to work? How much money do you want to make? When do you want to retire? So all those things go into building the vision of the practice. And then the second part that's so important is getting the team on board, ensuring that the team that's with the doctor is as bought into the vision of the practice as the doctor is, setting up operating agreements to make sure that everybody has a code of conduct that they share, and that no one person is responsible for everything. Each person is responsible for his or her own behavior, and the team will be there to make sure that you're staying on track. Because anyone that's ever played a team sport knows that, the quarterback may get all the glory, but he can't do anything if his wide receivers don't trust him. And he can't do anything if his defense isn't there to make sure he doesn't get kicked on his butt every single time he's got the ball. So it's very similar.
And I would say this, as a dentist, and I know this is going to sound trite, but my good days are clinical days. Yeah, I have an implant that has a screw broken, of course. I have an open contact at delivery. A patient breaks two veneers. We all have those freaking headaches. I get all that. But if you don't, then you're really not practicing. But
Or you're lying.
let's forget all that. Right, or you're lying. Right, exactly. But I think, here's the value, I think, of having or a coach in my life. As I'm trying to guide the team, I really don't have the time to fully guide the team beyond the clinical aspects. The clinical, I can guide them. But it's everything else that really is about running the business that dentists are just trying to make the time for. And a lot of dentists would do it on Fridays if they're not working, go to the office if they're whatever maybe, or they just ignore it. I think the coach acts such as an intermediary to make the practice move to the next level that often you have to go through uncomfortable decision making, but your coach is your coach. And I just can't keep reiterating that in this COVID era, those who want to rise to the top, I think with a great right hand or a great left hand of a coach, I think will really help.
Yeah, you're right, Lou. And I have often said that a really good coach is your cheerleader when you need it, and they're also going to kick you in your butt when you need it. Because as someone who's also worked with a coach, right, we know, Lou, I would say 85% of the challenges in a dental practice start where? Right with the leader, right? We have to take a hard look in the mirror and realize, whoa.
No doubt.
I don't.
Right.
That old thing about what's the
Right.
definition of insanity? Keep doing the same thing and expect a different result.
Right.
And plenty of doctors will come up to me and say, hey, I kind of know all this. And I say, that's awesome. Are you doing it every day? And usually I get, well, and I say, listen, I totally get it. I had my fingers, deep into someone's mouth for 9 hours a day, 4 days a week. I made myself go in the office on Fridays. But the reality is, at that point, I was only working on the business. I wasn't working on being a leader for my team. Because if my team wasn't there and I wasn't taking that time to train them on verbal skills, on customer service, on communication, then I was still only doing 2/3 of my job, right?
Right.
Yeah.
So let me ask you as we close on this, and you've been as wonderful as I would have imagined. Here's my question. Doctors worry about costs. That's the number one thing. I think doctors don't worry about as much. They all want to grow. Everybody wants to grow. If you don't want to grow, good luck to anybody out there. But how does a doctor best go about the process of interviewing the right coach? Let's end there. How do they interview for a coach or a consultant?
That's a great question, Lou. So one of the first things that we always ask a potential client is, tell me, doctor, where are you now? How did you get here? Where do you want to go? Do you have a game plan? And how can I help? Because the doctor needs to at least have a clue about where they are and where they want to go. So it's important for them to ask a potential coach. First off, I think it's really important to have great rapport with your coach. There are a number of programs out there, and let's face it, a lot of the things are basically the same. At Fortune, we're not teaching anything dramatically different about how to schedule to goal. I mean, that is a system. It's more a matter of making sure that you are simpatico with your coach, that it's someone that you trust to be able to, when you, as we say, open your kimono, we're not going to laugh. We're going to be there to say, listen, I got the same issues, and here's how I can help you. You need to tell me the 3 things that are challenging you the most right now. And as you know, Lou, those 3 things are usually multifactorial. So they may say, I can't close enough cases. Well, we know that it's not only because the doctor isn't presenting treatment. It may be that the hygienist isn't supporting them during the hygiene visit. Maybe their financial coordinator isn't giving the patient options on ways to afford treatment. Maybe the scheduling coordinator isn't making sure that the patient can be seen in a timely manner, or it may very well be that the doctor's just not presenting enough treatment. But we know that there are 10 different things that go usually into one issue. And so a good coach is able to, within just a few minutes of really talking to a client, because all of our problems are all the same, aren't they? They're just to different degrees. It's not like there's any dental practice out there now that's dealing with, something that is so unique that no other dental practice has ever encountered in the past 100 years. So it's really a matter of making sure that your coach is listening to you. A really good coach asks a lot of questions. And so when the doctor asks me questions, I usually am asking them questions back because I want to delve deeper to really see what their pain points are so that I can ensure that when we start to formulate a treatment plan together, a game plan for how to improve their practice and their life, that I am addressing what's most important to them. You know, we don't have any set agenda. It is, here's what we want to be able to do based on what you told me your 3 big issues are. So within 3 to 6 months, my goal is to get this checked off. And when we get this checked off, you're going to actually be happily surprised that these 3 other things also went away that maybe you weren't even thinking about, but that were vitally important as to the final result of your one main challenge.
Thank you. Jer, I try to keep these around 25. That was a whirlwind of info. Hopefully we'll get you back on. You know,
I would love
we're
to.
still going to be in this mess. Let's do it. We'll do that again. I just want to say thanks so much, and I really hope we get together. Thanks again.
Thanks so much for having me, Lou. It was really fantastic.
My pleasure. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.